Hello everyone, I'm Dr. Bang Jisung, your hair wizard here to protect your hair. It's a pleasure to meet you all. Today, following up on our last discussion, we'll address a common question. What will I look like 1 week post-surgery after hair transplantation? During consultations I can show you photos, but when I just say, you'll be fine. When I say you'll be fine, people don't know if I'm just saying it or if they really will look perfectly normal. At the 1 week mark, I always say you'll be perfectly fine. So by 1 week post-op, you should already be back to your normal daily routine, continuing with your usual activities. If you did have some swelling, there's a chance a little bit of it might still be there. Otherwise, by the first week, the inflammatory reaction should have largely diminished. So if you experience bruising or swelling, a small amount might still remain. But typically, most people appear perfectly fine with no significant issues. As long as there's no severe pain, you can go about your life freely, right? So if you keep your hair down, other people won't even notice you've had anything done. So by 1 week to 10 days post-op, you can absolutely return to your daily life, and I tell my patients that as often as possible. Actually, regarding the back of the head when patients look at the wound, take a look at this photo. It looks fine, but you might actually feel some itchiness or a stinging sensation. This is why. A common question I receive is, oh, the back of my head is so itchy and it stings. As a wound heals, dead skin cells form on its outer surface. Ideally, these should be cleansed away thoroughly, but the challenge is that due to the surgery, there was blood and other issues, so most people aren't effectively shampooing even a week later. Ultimately, your shampooing technique needs to be a bit better, but you're still quite hesitant and scared. You're worried about complications if you're too aggressive, so you're being extremely cautious. So instead of rubbing, you're often just gently stroking your hair when you shampoo. At this stage, the scalp's cleansing ability is diminished, often leading to excess dead skin, and for some, inflammation can arise, causing a messy, smelly, and itchy situation. So, for the first week to 10 days, I recommend what's called fingertip shampooing at the very least. I tell them that you absolutely must begin shampooing by gently rubbing the areas using your fingertips on the pads of your fingers. Once you start shampooing that way, any discomfort you feel will definitely get better. Understood? So, you must begin fingertip shampooing, and for the donor areas on the sides and back of your head, you can shampoo as you normally would. I assure you, all the discomfort you're clearly feeling will completely disappear. Looking at the pictures around 1 week post-op, the front area, particularly for men, often looks neatly trimmed, similar to a very short crew cut. So, it doesn't look too strange at all, and even if people around you do happen to notice, they sometimes get confused, wondering if you had a transplant or just got a really short haircut. So, unless your skin tone is significantly lighter than others, you truly don't need to stress too much from the 1 week mark onward. You can resume your daily activities and recover, so please don't worry excessively. Don't try to rest for an excessive amount of time, please. There are people who ask, I need to rest for a week, right? Or a month, right? However, if you've undergone a non-incisional FUE procedure and have even a moderate recovery ability, you can certainly and safely resume your daily life after just 1 week. Okay? That's my advice. Today we've looked at the recovery process 1 week to 10 days post-surgery. I encourage you to observe and form your own conclusions. It's really not that unusual, so please don't fret over it. I'll be sure to return with more information next time. Thank you.